Good day, future RMTs. Welcome to the discussion of pancreatic and gastrointestinal function. Our learning outcomes are as follows. Number one is to recall the function of pancreas and gastrointestinal system, as well as the metabolism of enzymes and hormones necessary in the biosynthesis and biochemical function of our pancreas and gastrointestinal system. Also is to interpret laboratory results to determine if there is an abnormality or problem in the biosynthesis metabolism of pancreas and gastrointestinal system. Start with, take note guys that digestion and absorption of food is a complex process which depends on the integrated activity of the organs of the alimentary tract. If you still remember when we said alimentary tract, it means that is the connection from mouth to anus. No, that is our digestive tract. Remember that the food is mixed with various digestive fluids, and these digestive fluids may contain uh, enzymes. And since it contains enzymes, there are cofactors that are important no, in breaking down the food into small molecules so that it will be reabsorbed by our intestinal epithelium. For example, no, uh, carbohydrate or polymeric carbohydrate such as starch undergo a series of uh, processes. No? There is what we call conversion to monosaccharide and disaccharide, and then later undergoing further hydrolysis by our intestinal uh, what you call this enzymes, no, so that it will be become to be monosaccharide, no, so that it will be reabsorbed, it will be digested by our body. Another example is the proteins. No, proteins are broken down into uh, its composition, no, such as your amino acids. Okay. Now remember that the proteins breakdown is through what we call proteases, which is secreted as an inactive precursor. And at the same time, we have your peptidases to oligopeptidases and amino acids. That's the broken down or the breakdown of our proteins. Another example is fat. No, the absorption of fat is necessary. Okay, saan naman? Necessary, okay? Because most fats are immiscible with water. Okay? That's why mechanical mixing and what we call actions of our bile salts create emulsion of triglycerides that is important in the absorption of the fats. Okay? Take note guys that all of these processes requires an intimate mixing of enzymes, cofactors, substrates, and the maintenance of an optimum pH so that there will be an activity, most especially the enzymatic activity. No? Remember that disorder in this gastrointestinal tract can compromise the activity of our stomach, of our pancreas, of our liver, and the small intestine, of course. Now, in addition, no, water is also one of the important uh, what you call this substances, no, being absorbed, no, in the gastrointestinal tract. So, what do we mean by gastrointestinal system? Now, remember, guys, as you can see, as depicted in this illustration, we have here your gastrointestinal system, and if you still remember your basic anatomy class, you said there that your gastrointestinal system is a combination, no? Or it is composed of the mouth, the esophagus, the small intestine, well, of course, the stomach. Okay? the large and the small intestine. Those are the composition of our gastrointestinal tract. And like what I've said a while ago, one of the most important functions of our gastrointestinal tract is to digest, no? The digestion. Take note, no? Digestion is a process by which starches, proteins, lipids, and nucleic acids are degraded rather to a molecules, no, for absorption and use of the body. So like what I've said a while ago. And then one of the most important part of our gastrointestinal system is the pancreas. Now, what is pancreas? Pancreas is a large organ, no, that is involved in the digestion, that is involved in the digestive process. However, no, even though that this is part of the digestive process, it is not included in the digestive system. Okay? It lies outside the digestive system because it is located behind the peritoneal cavity across the abdomen. Okay? If you're going to visualize it or if you're going to imagine it, nandun siya sa first and second vertebrae, no? Typically, 1 to 2 inches above the what you call this? Umbiculus, no? And one of the most important thing about pancreas, it has two functions. It can be endocrine that is capable of secreting hormones, and it is also considered as an exocrine gland, no? For enzyme naman, okay? And there are four major parts of the pancreas: the head, the neck, the body, and the tail. Okay? So this is another illustration of our gastrointestinal system as well as our pancreas. As you can see here, now this is an abdominal structure of our alimentary tract. No, we have here your stomach, no? This is the esophagus, the cardia, the connection between the esophagus and the small and the stomach, no? This is what we call the fundus, the body of the stomach, no? This is the lesser curvature and the greater curvature of the stomach. This is what we call the pylorus and the antrum, no? This is the common bile duct and the pancreatic duct as well as the ampulla. This is the ampulla vater, no? Take note that the end of your stomach is the connection to the small intestine. So small intestine is divided into three parts. We have your duodenum, followed by jejunum, followed by ileum. Ileum is connected to the large intestine. So we have here your cecum, we have here your ascending colon, we have here your descending colon, and this is the sigmoid colon, no, near the rectum and the anus. So this is one. This one is part of this large intestine. This is the appendix, and this is considered as our accessory gland. Okay? It is present there but no function at all. Now, on the other hand, you have here your uh, pancreas, no? The head, the neck, the body, and the tail. Okay? So this is the common bile duct as you can see here. And this is the accessory pancreatic duct, this one. Okay? So we have here your main pancreatic duct and your duodenal papilla, the connection between your pancreas and, of course, of our duodenum, the part of the small intestine. Now, like what I've said a while ago, our pancreas has two main functions. Number one is the endocrine component, and the other one is the exocrine component. Now, again, when we said endocrine component, no, uh, this is smaller than exocrine component. Okay? Remember guys that endocrine component is consist of the islets of the Langerhans. And as you all know, these islets of Langerhans are well defined, well delineated Okay? And spherical or ovoid clusters composed of at least 4 different cell types. And one of the most important thing about the endocrine component of the pancreas is that it is capable of secreting 4 hormones into the blood. And as we all know, we have here there your insulin, your glucagon, your gastrin, and of course, the somatostatin. Okay? Now, for our exocrine component, like what I've said, this is the component or the part of our pancreas that is capable of producing digestive tract, which is rich in enzyme, in the acinular cells, which line the pancreas and are connected by the small ducts. Take note, guys, that the exocrine component of the pancreas is capable of secreting 1.5 to 2 ml to 1.5 to 2 liters, I'm sorry, per day of fluid into the ducts that empty into duodenum, which is important in the function and in the synthesis, no, in the metabolism of the uh, substances in the body. Right? Well, of course, there are diseases that includes, no, or that affects our pancreas. One of the most common is the cystic fibrosis. Cystic fibrosis is a uh, what you call this? Autosomal, no? Autosomal recessive disorder, which is characterized by dysfunction of the mucus and exocrine gland throughout the body. Okay? In this patient or patient with cystic fibrosis develop abnormality in the sweat. No, kaya nga anong test natin sa kanya? Sweat test. Okay? Now, the manifestations of a patient with cystic fibrosis includes intestinal obstruction, most especially in newborn, excessive pulmonary infections in children, and pancreatinomatosis malabsorption in adults. Okay, take note, guys, that cystic fibrosis causes duct and acini to dilate and converts into small cysts filled with mucus. On the other hand, we have our pancreatic carcinoma or pancreatic cancer, which is defined as the fourth of the most common frequent, no, form of fatal cancer, which accounts to 5%, no, less than 5% ang survival rate nito, 5 years lang. One of the most severe forms of cancer is the pancreatic cancer. Okay? There are two forms or two types of pancreatic cancer. We have your adenocarcinoma and we have your neuroendocrine tumor. Or later, I'm going to show you a picture that shows you, the difference between pancreatic adenocarcinoma and pancreatic neuroendocrine tumor. Okay? So yan, ito. Kapag sinabi nating adenocarcinoma, it begins in the exocrine cells. Okay? So pag sinabi nating exocrine cells, ito yung component ng ating uh, pancreas, no, for the fluid, digestive fluid, no, which is rich in enzymes. So it begins with the exocrine cells that are responsible for the pancreatic enzymes. Okay? And of course, kapag naman neuroendocrine tumor, no, it begins in the endocrine cells responsible for producing the hormones. So, kapag ang problema natin is adenocarcinoma, the problem here is the enzymes, lipase and amylase, no, as to detect the destruction in the tissues in the pancreas. Now, if the problem is with the hormones, okay, ang problema naman natin dito is yung neuroendocrine tumor. Meaning to say, there is impaired in the secretion of the 4 hormones being named a while ago. The glucagon, the insulin, the gastrin, and the somatostatin. As of all the 4 hormones produced by the pancreas, it is only insulin that is capable of lowering, no, the glucose amount in the body. That's why A patient with problem in the pancreas, okay, it's either the pancreas is not capable of secreting, excuse me, secreting the what you call this? Secreting the insulin. Okay? Ang problema nun, neuroendocrine. Okay? But not necessarily meron agad siyang tumor. That's why a patient with pancreatic cancer also develops excuse me, hyperglycemia. Okay? A patient with pancreatic cancer, most especially if the origin is neuroendocrine tumor, no, nagde-develop siya ng hyperglycemia. That's why one of the medications or one of the management ng may mga pancreatic cancer is giving off insulin. Okay? Most especially if the problem is neuroendocrine tumor. Okay. So we have also here your pancreatitis, like what I've said a while ago. This is an inflammation of the pancreas, now mainly caused by autodigestion of pancreas as a result of reflux of bile or duodenal contents into the pancreatic duct. No? And as we all know, there are two most important enzymes that will evaluate the severity of our pancreatitis, because pancreatitis can be classified as your chronic and acute pancreatitis. And our lipase, no, between amylase and lipase, we said that this lipase is one of the most useful, no, to differentiate or to categorize the severity of the pancreatitis. Take note that uh, ayan, pathologic changes includes acute edema, cellular infiltration, and intrahepatic and extrahepatic pancreatic fat necrosis. Now, as a result, no, as a result of all three conditions, no, in severely diminished pancreatic exocrine function, compromising digestion and absorption as one of the key roles of the pancreas for digestion and absorption. For digestion, for the enzymes, no, for the hormones, as well as for the absorption, no. That's why patient with pancreatitis also develop what we call malabsorption syndrome. Okay? So malabsorption syndrome is defined as an abdominal bloating and discomfort. Frequently, there's a passage of a bulky, malodorous feces and weight loss seen in a patient with pancreatitis. Okay? Now, moving forward to the test for our pancreatic function. We have here your secretin and CCK. No, what is this test all about? Remember that this is a direct determination of exocrine secretory capacity of the pancreas. Okay, so okay, meaning to say it assesses the capability of our uh, pancreas, no, for its exocrine function. Okay? Remember, ito pong secretin natin, ha? Take note of this. Our secretin has three main functions. Ano po yun? Number one is the regulation of the gastric fluid. Number two is the regulation of pancreatic bicarbonate. And of course, the last one is the osmoregulation. And the major function or action of secretin is the stimulation of the pancreatic fluid and bicarbonate secretin. Okay? And this test includes intubation of duodenum, no, without contamination by gastric fluid, which would neutralize any bicarbonate, because this is base and this is a highly acidic fluid. No, it is performed. Okay, it is performed after 6 hours or overnight fasting. Okay. Now, you might be wonder what do we mean by CCK? CCK stands for cholecytokinin. Okay? Cholecytokinin. Okay? So these are the tests for pancreatic function, not one of the tests for pancreatic function. Now, after the pancreatic stimulation, now, uh, followed by the stimulated by secretin, followed by the CCK, and the collection of secretions are collected for 30, 60, and 80 minutes after the administration of the stimulants. Now take note that in secretin and CCK test, we are going to measure, excuse me, the pH, the secretory rate, the enzyme activities, as well as the bicarbonate activity of the patient. Leading to other tests, we have your fat fecal analysis. Okay, remember, excuse me, that the fat fecal analysis, no, is a fecal lipid that are derived from four sources. What are these four sources of fat fecal or fecal fat? Now we have here your unabsorbed indigested lipids, lipid secreted into intestine, cells shed into the intestine, metabolism of the intestinal bacteria. And we have the Sudan staining because Sudan, no, Sudan 3 or any Sudan, no, is a fat stain, no, which will give a orange color. Ayan, yellow-orange color to red, no, with Sudan 3 because it is more soluble than lipid. Okay? We also have here your gravimetric method. No? In gravimetric method, this one is using the Sudan is just qualitative, positive or negative in the presence of the fats, no, in the stool. No? Kapag nag-orange, red ang stool because of the Sudan, because of the affinity to Sudan, positive for our fats. No? How about we want to measure, we want to quantify. So we have what we call your quantitative screening, which is a gravimetric method. No? This one, if you still remember, I said that there are tests, no, that requires the entire stool, not sometimes 3-day collection of the stool, and that is usually used in the quantitative screening. No, the entire fecal specimen is emulsified with water. Then after the emulsion of the stool in the water, an aliquot, so meaning to say a portion of the emulsion will be acidified to convert all fatty acid soaps into free fatty acids. Bakit? Kasi magkakaroon ng split, no, sa fats because of the addition of the acid, no? The breakdown. Kaya magkakaroon tayo ng free fatty acids. Okay? Now, the most lipids are excreted into petroleum ether and ethanol. Okay? And after evaporation of organic solvents, lipid residues is weight. Now, other methods now in use is the infrared and the NMRS. Aside from that, we can also use the sweat electrolyte determination, usually for cystic fibrosis. Okay? Kagaya ng sinabi ko sa inyo, a sweat test, no, for cystic fibrosis is one of the tests. No? As we all know, cystic fibrosis is a condition involving the pancreas. Okay? So we have here the measurement of the sweat sodium and chloride concentration, which is useful for the cystic fibrosis. Now, for children, the sweat sodium and chloride above 60 millimoles per liter is considered diagnostic, while for adults is 80 millimoles per liter is considered as diagnostic. No? There are procedures in order to collect sweat before the use of pilocarpine. No, before the use of pilocarpine, yung pasyente binabalot ng plastic. No, this is the conventional, the traditional. Binabalot ng plastic yung patient so that the patient will sweat and then the sweat will be collected and then itetest yun. Kasi nga, ang problema kasi dito sa mayroong cystic fibrosis, yung kanilang mga pores, no, medyo makakapal. Kaya hindi rin makapag-secrete ng sweat, no? Kaya kailangan magkameron tayo ng administration of pilocarpine so that the patient will produce sweat. Okay? Aside from that, there definitely serum enzymes is also one of the important pancreatic function tests. No, test to assess the pancreatic function. We have here your amylase and we have here your lipase. Okay? In terms of diagnosing acute pancreatitis, so si amylase is useful. But in terms of more sensitivity about uh, about the pancreatic function, we have here your lipase because as we all know, amylase is also produced in the salivary gland. Kaya nga meron tayong tinatawag na amylase S and amylase P. Amylase S is salivary and amylase P is pancreatic. Okay? And yun, most of the doctors or some of the physicians considered lipase as more sensitive than amylase. No, that's why we are using lipase not to know the severity of the pancreatitis. Now, the physiology and biochemistry of gastric secretion. We have here the stimuli triggering gastric secretion, no, which is a neurologic impulses from the brain transmitted by the vagal nerves. No, hormone gastrin is the most potent, as we please take note of that. No, while for the inhibitors of gastric secretion, take note that high gastric acidity, which decreases the release no of the gastrin by the G cells, and of course, gastric inhibitory peptide secretion secreted by the K cells. And we have the vasoactive intestinal polypeptide produced by the H cells. Now, what are the clinical aspects of gastric analysis? There are three purposes of the gastric analysis. Okay, number one is for the detection of hypersecretion and detection of hypersecretion of our gastric. Now, is a characteristic of a condition known as your Zollinger-Ellison syndrome. Okay, which we are going to discuss in a while. Okay, occasionally to evaluate the presence of pernicious anemia in patient or in adults. Well, of course. And of course, you have here the to aid determining the type of surgical procedures required for the ulcer treatment. Okay. Now, what will be the stimulus for gastric analysis? No, we have your pentagastrin. Now, take note, pentagastrin stimulates the production of gastrin of gastric. Okay. Now, what do we mean by uh, this one? Zollinger-Ellison syndrome. Take note that this is a condition, actually a rare condition, no? A rare condition that involves tumors. These tumors are anong tawag dito? Tumor forms in the pancreas. Okay? And not only in the pancreas but also in the upper part of the small intestine, particularly in the duodenum. Okay? Sometimes these tumors is referred as the gastrinomas. No? Take note. Sometimes this tumor, I will write it, the tumor associated in the Zollinger-Ellison syndrome can be seen in the pancreas or in the upper part of the duodenum. Okay? And this tumor is called as your gastrinomas. Okay? Now, this tumor secrete large amount of hormone gastrin. No? This tumor, okay, increases the secretion of the hormone gastrin. Okay? Which causes the stomach of a patient with Zollinger-Ellison syndrome to produce too much acidic environment that leads into hyperacidity. Hey, aside from that, since there is a too much production of gastrin that triggers the acidity level of the gastric of the area, it results to what we call peptic ulcer. Okay, it resulted into what we call peptic ulcer. And aside from that, there is also what we call diarrhea. No? There is also what we call diarrhea. Ano yung masakit dito? In Zollinger-Ellison syndrome, it may occur any time of the life. Pwedeng bata, pwedeng matanda. No, but usually, patient ages from 20 to 60 years old. Okay? Ages 20 to 60 years old. Ano yung mga manifestations ng patient na mayroong Zollinger-Ellison syndrome? Of course, since that is involves no the gastrointestinal tract, definitely there will be abdominal pain. As like I've said a while ago, there is also diarrhea, burning sensation because of the acidity. Okay? Uh, Acid reflux, heartburn, burping, excessive burping, nausea, vomiting, na bleeding in the digestive tract. What do we expect in the color of the stool? Black. Bakit? Kasi upper digestive tract to eh. Decreased appetite and then intended weight loss. Those are the signs and symptoms of a patient with Zollinger-Ellison syndrome. Okay? Uh, ano yung one of the saddest thing about Zollinger-Ellison syndrome? The etiology, no? The exact etiology of the condition remains unknown, no? Remains unknown. Now, moving forward, the measuring of gastric acid in basal maximal secretory test. If you still remember our discussion in clinical microscopy, we have there the MAO and the BAO, na the basal acid output, no, and the maximal acid output. Na that is important in what we call your pangalan nito, measurement of our gastric acid. Now, paano ko to ginagawa? If you still remember, a patient must undergo an overnight fasting. Okay? An overnight fasting performed as 1 hour basal test followed by 1 hour stimulation. Okay? The stimulation is usually the use of what we call pentagastrin. Pentagas. Okay? Stimulation of pentagastrin. Now, after that, in stimulation, no, meron tayong basal, no? Wala pa. Wala pa tayong pentagastrin. And after an hour, magko-collect ulit tayo after the stimulation of pentagastrin. Now take note in the stimulated secretion specimen, no, we are going to measure the ability of the stomach to secrete, no, against a hydrogen ion. Now determined by measuring the pH. In connection to that, the gastrin responds to secretin, no, secretin stimulation by the use of may be used to patient with mildly elevated serum gastrin level. Now, take note that in gastric acid, basal and maximal acid output, no, a pure pocrine, no, a pure pocrine secretion is injected and gastric levels are collected at a 5-minute interval for 30 minutes. Now, how about for plasma gastrin? For plasma gastrin, now this is invaluable in diagnosing Zollinger-Ellison syndrome. All right, for our intestinal physiology, no, like note, like what I've said a while ago, digestion is one of the most important function of our digestive system, of our gastrointestinal system. And the digestion is primarily a function of the small intestine. Okay? Now, digestion is important, like what I've said. Digestion is important for absorption, right, to occur for the most large molecules. Now, there are four major processes of our digestion. Number one is, take note guys, that 7 to 10 ml, 7 to 10 liters, no, 7 to 10 liters of ingested water and food okay, as well as secretion from salivary glands, stomach, pancreas, and biliary tract enters into our duodenum. Again, take note that duodenum is the uh, first, kumbaga ito yung entrance, no, ng ng ating small intestine. There is a connection from coming from the pancreas, coming from the liver, coming from the ano yun? Stomach, okay, in the duodenum. Okay? And approximately 7 to 10 liters ang pumapasok sa ating duodenum. Okay? Now, of all this, no, of all this, only 1.5 liters of secretion is added, no, that reaches the cesium. No, and this cesium is the connection, is the part of our intestine, no, of our what you call this? Ayan, okay lang. Of our large intestine, no? From from ileum, no, from ileum going to the large intestine, and that first part is our cesium. Okay? Take note. Once again, no, material that enters, or materials, should I say, that enters jejunum and ileum, no, where only 1.5 of the secretion is added, only 1.5 liters of that fluid enters or reaches the cesium. Now, uh, the intestinal mucosal folds, now take note, the intestinal mucosal folds, the villi, and the microvilli, no, in the small intestine allows the massive absorption that is part of the digestion. And lastly, the large intestine absorbs water and stores feces before defecation. So again, our small intestine is predominantly the part of the gastrointestinal tract that serves, no, for the digestion process. Our large intestine is for the reabsorption and storage of feces before defecation. Now, there are diseases that causes malabsorption, no? There are diseases that causes malabsorption. What are those? This includes, no, uh, tropical and non-tropical or iliac sprue, Whipple, Whipple syndrome, disease. I'm sorry. We also have here your uh, Crohn's disease, intestinal or primary intestinal lymphoma. Okay. We have here your small intestine resection. We have your intestinal, no? We have here your intestinal lymphangectasia, ischemia, amyloidosis, and Georgiasis. No? These are the diseases, no, that causes malabsorption. Actually, dagdagan natin. Pwede natin idagdag dito si strongyloides stercoralis or strongyloidiasis. No? Si strongyloides stercoralis is also capable of causing malabsorption. Actually, kung gusto nating dagdagan, pwede din nating idagdag si fasciolopsis. Diba? Pwede rin siya. Now, before we discuss, ano ba yung mga sakit na yan? It is nice. What do we mean by malabsorption? Okay? Remember guys, kapag sinabi nating malabsorption, that is a term. No? A term, a process. Kaya nga, ION eh. Sean. Ibig sabihin ng process. That is a process that refers to the impaired absorption, impaired absorption of the products of the digestive system. Meaning to say, there is a impaired absorption of the products of our digestion. Okay? Ano po yung ibig sabihin or ano po yung pinagkaiba ng maldigestion from malabsorption. Again, kapag sinabi nating malabsorption, there is an impaired absorption of the products of impaired, no? Impaired absorption of the products of digestion. Our gastrointestinal tract is capable to digest, but our body is not capable of absorbing the digested products. So, what do we mean by maldigestion? From the word itself, maldigestion, it means that there is a failure of digestion. Okay? There is a failure of digestion. Eh, ano ngayon? Kung may failure of digestion. Remember, no? This may be responsible for non-absorption of nutrients. Okay. In maldigestion, differ a failure in digestion, which can lead to wala kang ma-absorb na nutrients. Sa malabsorption, merong digestion but there is impaired absorption of the products of digestion. Okay? Now, for example, in what we call pancreatic insufficiency. Okay? Walang digestion sa pancreatic insufficiency. Walang enzyme, walang hormone. Remember guys that the clinical features of malabsorption are varied and stem from deficiency of nutrients or retention of the nutrients within the bowel lumen. Okay? Ano ngayon yung clinical features ng merong malabsorption? Diarrhea, steatorrhea, that is true to Giardiasis. Di ba? Abdominal discomfort and distension, flatulence. Okay, kay Giardiasis ulit yon. Well, actually, lahat ng mga yan meron. But I'm just trying to relate. Ngayon, kung tayo ay merong mild absorption, definitely meron tayong decrease in the absorption of nutrients. And what are those nutrients? No? What are those nutrients? Anemia. Pag anemia, teka lang, baka malito kayo. Anemia yung sakit na nagiging dahilan because of malabsorption. Why? Because of decreased absorption saan? Sa iron, sa folate, and vitamin B12. Sulat ko nga. Black screen. Yon. White. Okay, so ulitin natin. Kapag daw tayo ay merong malabsorption, definitely meron tayong impaired absorption of the nutrients. Okay? Decrease. Absorption. Absorption of nutrients. Ano yun? Number 1, we have folate, iron, vitamin B12, which can lead into anemia. Okay? Aside from that, vitamin D deficiency. Okay? Lagyan natin deficiency. Okay? Vitamin D deficiency. Anong problema natin dito? Okay? Our problem here is your osteomalacia What else? Rickets. Okay? Vitamin K deficiency. Anong sakit natin dito? Bleeding tendencies. As vitamin K is important, no? Cofactor in the primary homeostasis. Bleeding, ano yan, disorder. Vitamin K, di ba meron tayong mga vitamin K, alam nito, coagulation factors. So kapag meron kang problem sa vitamin K, edi most probably pwede kang mag-develop ng ano, bleeding disorder. Okay? Well, definitely mayroong weight loss. Mayroong malabsorption eh. Okay? Failure of growth in the children. By the way, aside from anemia na nakukos ng iron deficiency, idagdag din natin iron deficiency. You have here your angular stomatitis. Okay? No. Stomatitis. Ano stomatitis? Stomatitis. Okay. So yan. Ito yung mga decrease na absorption ng nutrients. Vitamin B12, iron, folate, vitamin D, vitamin K. At ito yung mga pwedeng mangyari sa pasyente na mayroong malabsorption. Now, how about the causes? No? Sabi nga natin, bakit nga mayroong impaired? Ano yung mga dahilan? Pancreatic enzyme deficiency. Okay, causes. Lagay natin, causes of malabsorption. Causes of malabsorption. Number 1 is your pancreatic enzyme deficiency. Okay? Which includes the conditions such as chronic pancreatitis and cystic fibrosis. Another cause of malabsorption is bile deficiency. Okay? Bile salt deficiency. Importante ito sa ating mga lipids. Okay? Which can lead into bile duct obstruction and hepatic disease. Now what else? Other cause is intestinal. No, halimbawa, celiac disease, tropical sprue, Crohn's disease, and partial resection. O kagaya ng mga sinabi natin kanina. Okay? Intestinal diseases. And lastly, it can also be caused by bacterial overgrowth. Okay? Bacterial overgrowth such as diverticulitis, no? Diverticulosis. I'm sorry. Diverticulosis. Okay. So yan, si malabsorption. Kagaya ng sinabi ko, ito yung mga diseases na nagkakos ng malabsorption. What do we mean by Whipple disease? This is a rare bacterial infection, no? That most common affects the joints and digestive system. Okay? In this condition, there is what we call interferes with the normal digestion. Ano nagkakameron ng interference? By impairing the breakdown of foods, hampering your body ability to absorb nutrients. Now, hindi porket gastrointestinal lang to, yun lang. It can also infect the brain, the heart, and the eyes. How about Crohn's disease? This is a type of inflammatory bowel disease, or what we call the IBD. It causes inflammation of your digestive tract, no? Which can lead into abdominal pain, take note, abdominal pain, diarrhea, fatigue, weight loss, and malnutrition. Inflammation caused by Crohn's disease can also involve different areas of the digestive tract. Okay? How about lymphoma? Okay? Lymphoma is a cancer of the lymphatic system, okay? Which is part of the body's germ fighting network. Okay? Take note that lymphatic system includes the lymph nodes, the spleen, the thymus, and the bone marrow. Remember that lymphoma can affect all of these areas as well as the other organs throughout the body. And there are two major class or types of lymphoma. We have the Hodgkin's lymphoma and we have the non-Hodgkin's lymphoma. Okay? Now, what do we mean by intestinal lymphangiectasia? Kapag sinabi nating intestinal lymphangiectasia, again, this is a rare disorder in the lymph vessel supplying the lining of the small intestine are blocked because of malabsorption. Now, what will happen? This disorder is a result of improperly formed intestinal lymph or blockage of the lymph flow. Okay? A patient with intestinal lymphangiectasia includes experience diarrhea, swelling of the legs are the main symptoms. And the diagnosis of lymphangiectasia is the biopsy. Okay? Now, how about, skip na natin si ischemia, alam niyo na yan. How about amyloidosis? Amyloidosis is a rare disorder that occurs in the abnormal protein. And that abnormal protein is from the word itself, that is your amyloid. Okay? Wherein there is a build-up in the organ and interferes the normal function. Okay? Amyloid is not a normally found in the body. Take note, amyloid is not normally found in the body, but can be found in several types of protein. Okay? Now, the other test for intestinal function is your lactose tolerance test. Okay? Lactose tolerance test is a disaccharide lactase and sucrase are produced by the mucosal cells of the intestine, small intestine. No? Acquired deficiency of lactase are common in adults. And we also have affected patients experience abdominal discomfort, cramps, diarrhea after ingesting milk or milk products. Now, take note that in America, no, 10 to 20% are being diagnosed with lactose intolerance and 75% naman sa African Americans. No? Remember that lactose tolerance test is established, no? Diagnosis is subjected to false positive or false negative result. Okay? So you have here your D-xylose absorption test. D-xylose is a pentose sugar ordinarily not present in the blood. No? Pentose sugars are absorbed and altered in the proximal small intestine. Now, what are the process? No, an overnight fasting is required. No, the patient avoids and drinks D-xylose solution. Then after that, the patient drinks equivalent amount of water during the next hour. Urine is collected for 5 hours after the ingestion of the drink, and blood is collected at 2 hours. Again, urine is collected for 5 hours after the ingestion, and the blood is collected at 2 hours. Heading forward to serum carotenoids. Now, these are various yellow to orange or purple pigment widely distributed in the animal tissues. Remember that the major carotenoid in human is the serum are lycopene. Sulat po natin. Take note that the major carotenoids in the human serum are your lycopene, xanthopryl, and the beta carotene. Now take note that beta carotene is a precursor of vitamin A. Okay. Remember also that carotenoids are fat soluble and absorbed in the small intestine with lipids. Now, if in case that there is a malabsorption of lipids, no, serum concentration of carotenoids is lower than the reference range of 50 to 250 mg per dl. This is the reference range of carotenoids. And if the patient has malabsorption less than 50 mg per dl ang kanyang carotenoids. Now, these are the other tests for intestinal malabsorption. No? We have your diminished appetite or dietary intake, body wasting or CACSA, negative nitrogen balance, decreased serum proteins and albumin, deficiency of the fat-soluble vitamins, ADEC, deficiency of vitamin K-dependent coagulation factors because of the deficiency in vitamin K, anemia because of diminished iron and calcium absorption, as what I've discussed a while ago, decreased sodium and potassium level because of dehydration due to diarrhea, no, decreased and flat blood concentration, curves in the glucose, lactose, and serum, uh, serum, sucrose tolerance test. Now, so ano yung mga test na yan? No, ito yung mga nangyayari. So ano yung mga test na pwede natin gamitin? We have your serum albumin, serum alb, okay, calcium. We also have your phosphate in connection to calcium. We also have your ALP. Kasi bakit? Intestine eh. Di ba? Uh, CBC, complete blood count, which includes, well, of course, the red cell indices, the MCV, the MCH, and the MCHC. Iron, okay, ferritin is also important. What else? Vitamin B12, okay, folate, and of course, prothrombin. Thrombin. Right. Okay. So these are the other essential tests, no, for malabsorption, for intestinal malabsorption. Okay. So thank you very much for listening, and I want you to listen to my synthesis. Okay. Remember, guys, that the gastrointestinal tract is responsible for digestion and absorption. Yun yung dalawang important parts or functions of our gastrointestinal tract for absorption and digestion of foods. No, this process also depends on the normal hepatic and pancreatic function. Hepatic because of the bile, okay, and controlled by both neural and humoral mechanisms. Now remember that again, no, malabsorption syndrome can be a result of intestinal, pancreatic, or hepatic dysfunction. Significant tests can readily be excluded by simple tests on blood or serum. Remember that if malabsorption is obvious clinically, for instance, because of weight loss and gross steatorrhea, test for malabsorption and nothing to the diagnosis. Bakit? Eh, alam mo na eh. Bakit kailangan mo pang i-test ang malabsorption? Meron na siyang muscle wasting, meron na siyang decreased weight, and then maldigestion. No? Remember that once the diagnosis of maldigestion has been made, investigations are required to determine the cause if that is not obviously clinical. Biochemical, histological, radiological data may be collected to be useful in the content. And lastly, we have your intestinal failure. Now, the intestinal failure is most commonly most frequently, ano ba yan? Most frequently complicates resection of the small intestine or what we call Crohn's disease. Okay? We also have your acute and chronic pancreatitis. Acute pancreatitis is typically presents as an acute abdomen, increase in serum amylase activity, and uh, there is shock, renal involvement or renal failure, hypocalcemia, and hyperglycemia may occur. Bakit? Impaired yung function ng ating pancreas. Si pancreas yung capable mag-secrete ng glucagon at saka ng insulin. Sila ay merong opposite effect sa isa't isa. For chronic pancreatitis naman, usually present with pain and or malabsorption. Alcohol is the common cause of chronic pancreatitis. And sad to say, pancreatic damage is irreversible. No? Irreversible. Once again, thank you very much and do not forget to like, subscribe, and scan the code. Thank you.